Welcome to the conference session titled Living Your Best Life, Exercise and Nutrition. Thank you for joining us. My name is Lee Clark, patient educator, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generosity of our corporate sponsors and the generous support of our patients, families, and caregivers for supporting the program today. Immediately following the presentation, there will be a question and answer session. Please feel free to submit your questions at any time during the presentation from the Q&A icon in the engagement panel on your right. To submit a question or comment, type your question in the Q&A text box window, and when you have finished typing, just hit enter. We'll do our best to get to everyone's questions today. When asking questions, I do ask that you do two things to help us manage the incoming questions. First, submit your entire question all at the same time. Second, please do not share private health information in your question. Our speaker cannot answer any specific questions related to your health care. During the session, you will see that there are a few polling questions for the audience to respond in real time. You will be able to access the poll on the right-hand side of the engagement panel. Just click on the icon in the panel and you can answer the question should you choose. Our specialist today is Dr. Catherine Schmitz. She is a professor in the Department of Public Health Sciences and a behavioral research professor in the Department of Physical Medicine and Rehabilitation at the Penn State Cancer Institute. She is a leading researcher in exercise oncology, which is the use of exercise in cancer prevention, control, and survivorship. Dr. Schmitz has led many exercise trials and translated her work into clinical practice. She has published more than 240 peer-reviewed scientific papers. It is my pleasure to welcome Dr. Schmitz, and thank you so much for joining us today.
Ooh. No. Am I unmuted now?
You're very good. Yes.
Oh, good. Okay. Thank you, Lee. So appreciate it. I'm delighted to be with you all today and to have an opportunity to talk about something very near and dear to my heart. I've spent the last 20 years of my life focused on exercise and cancer. So I'll note for you in the bottom left-hand corner of my first slide that I've given you my Twitter and Instagram handles. I am quite active on social media because one of the issues in the field of exercise and nutrition and cancer is that there's a lot of misinformation out there. And I think that for us to translate the substantive evidence base that supports a healthy diet and exercise during and after cancer treatment, we need to share that information broadly in social media. So I invite you to join me there on Twitter or Instagram. So hopefully you are going to get my next slide, which tells you what I'm going to talk about today. So the first is why? Why should I exercise? Why should I eat healthy? What is in it for me? So exercise, will it help to address symptoms? And I'll talk very specifically about which symptoms and how and why. I want to give you a little bit of information about nutrition tips as well. And then I have a section of my talk that I call What is Possible? And this is intended to be inspiration from other patients and survivors as to what is possible after a diagnosis of cancer with regard to athletic performance. And I hope that you'll have lots of questions for me and that we'll have a robust discussion after I finish my talk today. So just to give you an idea of exactly why this kind of talk is evidence-based and it's not just somebody here in a little box talking to you that likes exercise. I want to give you a little bit of a history lesson for a moment and share with you that as far back as 1938, there were studies that showed in animals that being more physically active was associated with less growth of tumors that were injected into the rodent model. There was in 1989 two nursing researchers at The Ohio State University who conducted the first human clinical trials of exercise in people who had a diagnosis of cancer. They were studying breast cancer in particular. And then in 1996, there was the first review in the area of exercise and cancer. And that review included 4 clinical trials. And what they concluded, not surprisingly, is that more research was needed. And by 2005, I did the first meta-analysis in this area, which means taking all of the available evidence and putting it into, pooling it all together into one paper. And we found 22 high-quality clinical trials at that time. In 2010, my home organization for my professional work is American College of Sports Medicine. And in 2010, ACSM held the first roundtable on exercise and cancer. And at that time, you can see that there were about 225 randomized controlled trials in the area of exercise, physical activity, and cancer. In the period of time between 2010 and 2018, there was literally an exponential growth in the number of clinical trials that were done to establish the efficacy of exercise training during and after cancer diagnosis and treatment, to show physiologic benefits, psychosocial benefits, survival benefits. And as a result of that, what you can see is that the American College of Sports Medicine decided that they would hold a second roundtable. This roundtable was held in March of 2018, and it was in San Francisco back when we used to all travel a whole lot more than we do now. I am very proud to have co-chaired this with my good friend and colleague from the National Cancer Institute, Chuck Matthews. What I want to note for you in noting all of these, this alphabet soup of pertinent organizations, is that we very purposefully made this a multidisciplinary roundtable. We had medical oncologists in the room, we had surgical oncologists, we had family practice doctors, oncology nurses, physical therapists, rehabilitation doctors, people from a variety of different types of medical specialties that deal with cancer patients and survivors. We also had a good representation from around the world as well. So there were 3 papers that came out of that roundtable, but the one that I'm going to focus on today that was published in October of 2019 was very capably co-led by 2 of my colleagues, Kristen Campbell and Carrie Winter-Stone. And the goal of this paper was to look at the effects of exercise on health-related outcomes that are not cancer in itself, that are all of the symptoms and side effects that come with a cancer diagnosis and treatment. So the idea behind this paper and what we were interested in doing here was a fit prescription. And what we mean by that can be explained by analogy. So we don't tell people to go out and get some chemotherapy, right? So we are very, very more specific than that. We say we're going to give you doxorubicin, we're going to give it to you in every 2-week cycles, we're going to give you 6 cycles of this, and the amount is going to be according to your body weight. And if your body weight changes, then we change that dose, right? Well, what would happen if we could prescribe exercise precisely like doxorubicin, like a chemotherapy medicine? Would we be able to tell you specifically the frequency that you need to do of the exercise, the intensity, the time, and the type of exercise in order for you to garner the very specific benefits that we have seen in the clinical trials that I noted from that graph a few slides ago. So I just one more slide before I show you what the results were of this review. I wanted to help you to understand that the way that we made decisions about whether something had enough evidence and we could draw a fit prescription and say, yes, we can tell you exactly what to do for this outcome or not, was based on a rubric that was originally developed for the Dutch National Physical Activity Guidelines. What you'll note on the left side of this slide is that we started by reviewing only randomized controlled trials. So we did not include any observational studies in this review. We then looked to see whether or not for a given outcome, and we reviewed 16 outcomes, and I'll show you which ones those were in the next slide, but we looked to see if there were 5 studies, at least 5 studies for example, sleep or fatigue. If there were 5 studies and there was a substantive effect, in other words, the effect was not close to 0, we then looked to see whether the effect was similar across the different studies. If they were similar, then we said that there was no heterogeneity in direction. We called that a strong level of evidence. That goes to the green box on the right side of the slide that says fit RX, fit prescription. If, on the other hand, we felt that there was some evidence, but there was more that could be garnered from additional studies, then we might say that there was a moderate level of evidence. And we said that was a yellow fit prescription. Anything else fell into the red boxes, insufficient evidence or evidence effect unlikely, and that would be no fit prescription. And so what we found in reviewing 16 different treatment side effects and late effects, long-term effects of cancer treatment is that there were 6 outcomes for which there was strong evidence for us to be able to make a fit prescription. And they were anxiety, depressive symptoms, cancer-related fatigue, health-related quality of life, which is defined as a sense of well-being, a sense that life is worth living. Lymphedema, we isolate that very specifically to evidence for breast cancer-related lymphedema, and physical function. Physical function being defined as your ability to do the things that you need to get done in your life in order for your life to go well. The ability to carry a case of water in from the car, the ability to push a stroller for a walk with a child or grandchild. So that was the strong evidence. And then in the moderate evidence category, we had bone health and sleep. And so we have evidence that tells us how much and how often and what kind of exercise is necessary to improve sleep. And in the insufficient category, we have 8 outcomes for which we are unable to draw a fit prescription. It doesn't mean that exercise isn't helpful for the cardiovascular outcomes that are secondary to cancer treatment, which is the cardiotoxicity listed first in this list. What that means is that we don't have enough studies done in order to draw that conclusion. So I'm going to go through one example just to give you an idea of the level of evidence. I'm not going to go through all of the 8 outcomes for which we're able to make a fit prescription. I'm going to go through one just to give you an idea of the evidence base, and then I'll show you an infographic and walk you through the fit prescriptions and tell you where to find the infographic for yourself. Cancer is ubiquitous as people go through their cancer treatment. Prevalence rates are sometimes as high as 90 to 100%. And it is also the outcome for which there is the largest evidence base for exercise oncology. There are about 200 randomized controlled trials that are currently available that have assessed the effects of exercise on cancer-related fatigue. In fact, there are a number of systematic reviews and meta-analyses, such as the one that is listed here from 2017, which have reviewed this very large evidence base. But I'm going to point to one in particular by Karen Moustian, which was published in 2017, that I think really tells us the most important information about the benefits of being more physically active and cancer-related fatigue. So I'm going to orient you to this slide because I'm going to make the assumption that I'm not talking to people who are scientists used to looking at data the way that it's presented in this table and graph. So on the left side of the slide, you can see the leftmost column says intervention. And then beneath that, it says all or pharmaceutical, exercise plus psychological or exercise. You can then say in the next column is the number of effect sizes. That's the number of studies that have been done that have looked at these various different outcomes. And then there's something called the WES, the weighted mean effect size. A weighted mean effect size of 0.3 or higher would be moderate to better. Okay, so really worth getting is a weighted mean effect size of 0.3 or more. And what I'll point out to you is the blue line that just showed up on the slide is that over 69 studies that were included in this meta-analysis, there was a weighted mean effect size for exercise being more physically active during and after cancer treatment of 0.30, which is really worth having. But what I would also point out to you, and I think is equally, if not more important, is if I underline in red what the weighted mean effect size is for drug studies, for pharmacologic interventions. If you are prescribed a drug in order to deal with your cancer-related fatigue, the likelihood that that will be effective is much less than the likelihood of an exercise intervention being effective in treating your cancer-related fatigue. So there is an infographic that my colleagues and I have developed over time and is freely available at the website noted here, exercisesmedicine.org/moving-through-cancer. There is an initiative through the American College of Sports Medicine called Moving Through Cancer, which has a goal of making exercise standard of care in oncology by 2029. So what I want to point out to you on this infographic is that at the top of the infographic in sort of various shades of blue are the guidelines that have to do with being more physically active to prevent cancer in the first place or to prevent recurrence of cancer. But what I'm really focusing on in this talk today is what's in the second half of the lower half of this infographic. So for people during and following cancer treatment, research shows that a lower amount of exercise than what is recommended for general public health can still help with a number of cancer treatment-related symptoms. And there's sort of a color coding of the icons here that I want to point out to you. So you can see the green icon says cancer-related fatigue. And what you might note is that if you go to the bottom of the slide, you can see you could do aerobic exercise 3 times a week for 30 to 60 minutes, and the green is lit up underneath that information. Or you could do resistance training twice a week, 2 sets, 8 to 15 repetitions, and the green is lit up. Or you can do the combination, and you can see the green is lit up. So you can do any one of these combinations of things, and you are likely to have a substantive effect on your cancer-related fatigue. By contrast, if we look at the bottom right hand of the 8 icons, you'll see bone health. It's pink and it looks like a bone. So what you'll see is that if you look at the bottom of the slide, there's only one type of exercise that lights up the pink icon, and that is resistance training. So this is what we mean by the FIT prescription. We can tell you with certainty based on the research that's been done to date that you need to do aerobic exercise for certain types of outcomes, and you need to do resistance training for other types of outcomes. All right, I'm going to switch to healthy eating for just a minute. Most of the information that I am about to share with you arises from the American Institute for Cancer Research. I would commend to you www.aicr.org as an outstanding and reliable source of information. There's a great deal of nutrition information out there. I have heard from my nutrition colleagues that they fear to let patients roam free in gathering information on the net because there's so much misinformation. So I can tell you that AICR is an outstanding source of information. Before I get going on any of my nutrition tips, I will say that if anyone tells you that there is one specific food that is going to treat your cancer and make a difference in treatment of your cancer, that is very definitely not going to be the case. It is exceedingly rare that a single food would make an enormous difference in an outcome for a cancer. All right, so the first thing that I'm going to cover is the New American Plate. And so this is a very public health oriented guideline, but it works for people living with and beyond cancer. The idea here is that 2/3 or more of your plate should be filled with fruits, vegetables, whole grains, and beans, and that only 1/3 or less of your plate should be filled with animal protein. That is the first guideline that I share with you. The second one is that you should be avoiding processed meats. The American Institute for Cancer Research recommends that if you normally eat cold cuts, that you consider switching to fresh turkey, chicken, or fish. That if you normally eat bacon or chorizo, that you switch to spicy veggie sausage. And that if you normally put sausage in your chili, that you consider switching to kidney or black beans. Another major recommendation from the American Institute for Cancer Research and the National Cancer Institute, the American Cancer Society, is to avoid sugar-sweetened beverages. And one of the things to be very clear about on this slide is that this is not just soft drinks that are sugared soft drinks. This is also fruit juice, sport drinks, and energy drinks. So what is recommended instead is that we all start drinking a whole lot of water. And my favorite tip on this is I have a soda stream and I fill the bottles with water and I put fizzy water and I fizz them and I don't put anything in them. You just drink fizzy water. And the effervescence does actually help me with drinking more water for me. Avoid alcohol. It is recommended that if you are not currently a drinker, that you do not begin to drink for your own cancer prevention goals. But if you do drink, the recommendation is no more than 2 drinks per day for men or 1 drink per day for women. I would again commend www.aicr.org and all of the information that I have just gone over with regard to the nutrition tips are providing these healthy living tips for cancer survivors. And you'll note that their recommendations for physical activity are very similar to what I went over earlier from the American College of Sports Medicine. And if you are someone who is currently dealing with treatment, if you're going through and dealing with treatment right now, and eating is a difficult thing, then the recommendation for you could be to use a meal delivery service. So something like HelloFresh or Purple Carrot or one of the many, many meal delivery services that are available. Staying hydrated is enormously important as you undergo cancer treatments. Use of meal replacements is a very real and useful way of making sure that you're getting adequate nutrition. Avoiding weight loss as you're going through treatment is a goal, is something that's an important goal. Keeping your weight stable, in other words, not just not losing weight, but also not gaining weight is very important as you go through treatment. And the final advice is if you are nauseous while you are going through a bout of nausea, or a period of time in your treatment when you tend to be nauseous, the advice is to stay away from your favorite foods because they will not be your favorite foods anymore if you associate them with throwing up. So now what I want to turn my attention to, which I hope will be motivating to you, is the what is possible. This is exercise oncology in action. The first example that I have is my dear friend, Bill Jolly, who goes by Jolly, and he is. In May of 2011, a friend of his invited him to train for a sprint triathlon. I should say that Jolly was a Marine Corps veteran, or is a Marine Corps veteran. And so he gained about 15 years since his Marine Corps days. He was looking the way he does in the upper picture on this slide. A month later, he was really exhausted just after 5 laps in the pool and thinking to himself, I know I'm out of shape, but I shouldn't be this tired. In July that year, he developed what he felt was chest congestion, nothing specific on a chest scan, but prescribed albuterol for what seemed to be adult onset asthma. He was doing a training of swimming and running in August, and a mile into the run, his friend said, damn, Jolly, I didn't know he had asthma. He was wheezing so bad. He said he sounded like he'd swallowed a whistle. So the next month, his primary care provider ordered a second chest scan. Probably nothing, probably an enlarged heart. You're an athlete. But a radiologist recommended a CT, and he was diagnosed with stage 3 lymphoma. The biopsy later that year revealed small lymphocytic lymphoma, and he started in January of the following year with 6 cycles of the standard of therapy for his disease. That same month, he started a leukemia lymphoma team in training for doing an Ironman. And he did the Marine Corps Marathon 5 months after chemo, the Outer Banks Olympic Tri in 2013, the Pinehurst, North Carolina Olympic Tri, 2014, the Bull City Half in 2018, but in 2016, he relapsed after 4 years. He felt an enlarged node. He went on oral targeted therapy and started to feel a lot of increased fatigue. There it is, the ubiquitous fatigue with treatment. And he writes, I felt myself, I'm sorry that I fixed the formatting here, and apparently PowerPoint didn't like how I fixed it. So I apologize for the formatting error. I felt myself going to a dark place and I didn't like it. I didn't want to work and I didn't want to talk to my wife or my kids. After 4 days of increasing depression by the day, I told my wife at 10:30 at night that I had to go run. 1 mile into the run, my fatigue and depression just vanished. I discovered I could keep fatigue and depression away as long as I exercised every other day. And so in fall of 2017, he completed his Ironman in North Carolina. So his ideal training plan makes my ideal training plan look like I'm sitting on the couch all the time. And I train 5 days a week. So, he has one rest day, and otherwise he is running, biking, and swimming the rest of the week, and then admits, I might miss 1 or 2 here or there because he has a very busy family and, oh, by the way, a job. His takeaways, I think, are really, really important. And Jolly allows me to share his story if I share these takeaways. And that is that he wants me to teach you to listen to your body. You'll know if something's wrong before a lab test. If something feels off, you just don't ignore it. Be quick to get help from allied health professionals, because medicine and surgery are not the only tools for you to deal with your treatment and your symptoms. Exercise can reduce and or eliminate medication symptoms and reduce occurrence in some cancers. And most importantly, exercise gives patients control of their life back. I hear over and over again from cancer survivors who I've spoken to about exercise during and after their treatment, that the most important thing that exercise has given them back is a sense that there is something to them other than having cancer, that they are not defined by their cancer, that in fact they are defined by their ability to walk a mile, walk 2 miles, run a mile. Another case study, Norma, age 61, was a metastatic breast cancer patient. She was diagnosed metastatic in 2016, and she had a number of other chronic conditions that are listed here. And when she enrolled into the Nurse Amy study that we have been running at Penn State, she walked in and she looked like a question mark. She was bent over to the point that she looked like a question mark. She was walking with a walker. She had to take frequent breaks to sit down due to weakness in her legs. And she'd had a prior surgery on her spine and had been told that she would mostly be bedridden for the rest of her life. We enrolled Norma in a program called Nurse Amy, which was a tablet-based supportive care intervention with a physical activity component to it. It starts with a hello and symptom question, an empathic response to the symptom question answer, and then guidance for any one of 5 different types of interventions that we try to make available through this tablet-based supportive care system, including physical activity. There's a weekly phone call with a navigator. All of this information is then shared with the oncology care team so that they can make decisions as to whether they see a pattern that leads them to say they need to step up and do something medically, or whether we should continue with self-care for symptoms. By the end of 3 months in this study, Norma was averaging 10,000 steps per day. She was able to ambulate on her own with no assistance, but she carried a cane for long distances just for security. When she came in to meet with the patient navigator, she strutted in, swinging her cane like Charlie Chaplin, just to show how well she could walk on her own. And to quote Norma, when I came over here, I was on the walker, but now I'm using the cane because I've been doing the exercise and my bones have been getting stronger. I love Nurse Amy. It helped me a lot. When I do exercise, it helps with the pain in my legs. I suffer a lot from pain. This is a great moment for me to say that having symptoms is sometimes seen as a reason not to exercise. And unfortunately, that's actually the wrong instinct. If you are having symptoms, unless those symptoms that you're being told by your physician specifically not to exercise, it is exceedingly likely that exercise will help with those symptoms. The list goes on. There is a pancreatic cancer survivor in Canada by the name of Sydney Hooper, who competes in Ironman competitions. Susan Helmrich is a 3-time survivor. She's a DES daughter. Some of you are familiar with what that means. She also has had lung cancer and pancreatic cancer, and she is a master swimmer based in the Bay Area. Gabriella Grunwald, who has since passed away, was diagnosed with adenoid cystic carcinoma in 2011. She was a sponsored ranked USA track and field runner who placed 4th in the 1500 in the Olympic trials for London and was the national champion for the 3,000 meter in 2014 with cancer. She had an Albert Einstein saying over her couch that I thought was quite compelling. There are 2 ways to live your life. The first is as if nothing is a miracle, and the other is as if everything is a miracle. Mike Levine was a stage 4 pancreatic cancer patient who, once he was given his diagnosis, decided to sit on the couch, and that was it. He was just going to fade away. And some of his friends who knew him well came to his house and said, "Come on, Mike, let's just go ride for a mile or 2. And they got him back into it. And even with stage 4 pancreatic cancer, he was able to compete one more time in the Ironman competition. And finally, Keegan Randall is a US gold medalist in cross-country skiing. And she was already a phenom because when she was at Pyeongchang, winning her gold medal, she was a young mother, which is a very unusual thing for an Olympian, a gold medalist. And then several months after she came back and was going into retirement from her Olympic career, she was diagnosed with an aggressive breast cancer. And she will tell you that, there were very, very definitely days that she just simply could not do any exercise. But it was by doing the exercise on the days that she could that she was able to know what was going on with her body. It was a way for her to be able to check in and be able to tell the doctors when something was really amiss. I just want to finish up by saying that I have written a new book for patients and caregivers called Moving Through Cancer. This is available for pre-sale now at Amazon, Barnes & Noble, and bookshop.com. And if you buy the book, then you get a free 1-year membership to what I like to call Peloton for Cancer Survivors. It's called myvictory.com. We plan a forthcoming website that I'm listing here as well. And I also want to point you back again to the American College of Sports Medicine website and the Exercises Medicine movement. So I will close there and see if there are any questions for me. And thank you very much.
And thank you, Dr. Smits. We do have a few questions. Our first question is, what would you recommend for dietary options for MDS patients to give us energy from extreme fatigue when our red blood counts are low?
Okay, so the first thing that I'm going to say is hydration is going to be enormous. I do understand the red blood cells being low, and that's a tough one. So I think that hydration, if hydration is going to make you, dehydration is going to make you feel that much slower and more fatigued. So making sure that you were well hydrated will give you the best chance to feel better as you're dealing with a low red blood cell count. I would also say that ensuring that you're getting sufficient protein. It is very common for cancer patients to be taking in too little protein. So you should be taking in 1.2 grams per kilogram per day. So if you go to go online and figure out, what your kilograms of body weight are and multiply that by 1.2, that's how many grams of protein you should be eating a day. And there's a wonderful online system called I think it's an app actually called MyFitnessPal. And there are a number of online resources available to help you to figure out how much protein is in a variety of different kinds of foods. So getting enough protein and staying hydrated. If you have difficulty getting enough protein in your diet, if it's just not palatable to you, then you can use protein supplements If you're not allergic to it, then, and most people aren't, whey protein is an excellent and low cost source of good solid protein. You can put that in, milk, juice, almond milk, whatever liquids you want to put it into. I hope that's helpful.
Thank you. And the next question is, what about coffee for patients?
What about coffee? Yeah, I don't know. I'm always like terrified that somebody's going to tell me that, I can't drink coffee anymore. I think that anything in moderation, it seems to me like it's okay. If you're drinking more than 2 cups a day, the problem with that is that can really, go through you and take the good nutrients with it. So it can cause diarrhea. It also can cause dehydration if you're drinking too much caffeine. So let's just keep it from being too much, I would say.
Thank you. Our next question says, if you are overweight, why can't you lose weight slowly? Wouldn't it be better to be healthy at a healthier weight? This individual is getting ready to undergo a bone marrow transplant in 6 months and wants to be as healthy as they can be going into transplant.
Yes. Okay, please get my book. There's a whole chapter for you called Prehabilitation. There's a whole program. Sorry, I've never felt like shilling a book was a good idea in a situation like this, but wow, did I write this for you. So let me tell you the program, and just in case you don't want to buy the book. So the program is, you've got to get protein. You've got to get yourself some protein. The second thing is that you want to examine what your physical activity level is right now. Take about a week to look at, okay, I'm doing something 3 times a week, or I'm doing something once a week. I'm getting this kind of, have a tracker of some kind, whether it's an Apple Watch or a Fitbit or a pedometer of some kind. Once you know what your baseline is, then you want to be increasing by at least 10%, if not 20% per week, so that you are training for the challenge of your life. We are doing a study at Penn State called Improve BMT that is all about this. The most important thing you can do, rather than focusing on your weight, is focusing on your muscle. You need to be increasing your muscle mass as much as you can between now and when you go through that bone marrow transplant. I'm a little excited about this. I hope this person really does this.
Great. Thank you, Dr. Smits. We have another question that says, do you like low carb diets for patients?
The research is coming along. And one of the things that I showed you was the New American Plate, right? And if you really examine that New American Plate, which is the recommendations from AICR, from ACS, from NCI, it's low carb. Okay, so how low is low? I think that I'm going to answer the question another way, and that is that I think that if you move in the direction of doing low carb, intermittent fasting, keto, all of these things, my strong recommendation to you, given the fact that you're dealing with additional health challenges, is that you log what's happening. That on a day-to-day basis, you log how your weight is changing, how your energy is changing, how your sleep is doing, whether your symptoms are changing, because you will know before any doctor will know if this is actually a bad idea for you.
Thank you. Our next question comes from an aplastic anemia patient who is experiencing low blood counts, red cell, white cell, and platelets, and their hemoglobin generally runs between 9 and 10. They'd like to know, how do you determine an appropriate exercise routine? They experience heart palpitations and shortness of breath just carrying groceries up the steps.
Okay, so my strong recommendation is that you do resistance training in order to increase your muscle mass, and I think that that's going to help your heart a tremendous amount with delivering blood and delivering the oxygen that it needs to your muscles. But I think that the way you're going to need to do it is going to need to be slightly different, and this is just fascinating. I just feel I'm fascinated with this question. So I think the way to do it is actually, normally what I would say is, here's 5 to 6 exercises, do them each 3 times, and then you have a session of resistance training. But for this situation, I think what you're likely to want to do is to spread it out over the course of 2 days and then start over. So if, for example, I want you to do 15 sets, all told, 5 exercises 3 times each, then you're going to do 3 sets at 8 o'clock in the morning, 3 sets at noon, 3 sets at 4 o'clock in the afternoon, and do the rest the next day, right? So so that you're not feeling the way that you feel when you bring groceries in. You're not doing anything that long. I hope I'm making sense with that. And let me know if I need to clarify.
Thank you, Dr. Smith. What do you feel about yoga?
I love yoga. So one of the things that's sort of frustrating about, when I wrote this book, I made a commitment that I was going to write about what the evidence base says. And, so the evidence base does not have, there's just not as many studies to tell us the benefits of yoga or the benefits of Pilates or Tai Chi or Qigong or some of these other modalities. And so, so I can't make strong recommendations, but I can personally attest to the value of yoga and Pilates and Tai Chi and those other modalities. So I think that what I also know, though, is that if you are interested in these fit prescription benefits, if you're interested in improvement in fatigue, if you're interested in improvement in anxiety, if you're interested in improvement in quality of life and function, and the other things that we mentioned before, you really have to do aerobic exercise and resistance. That's where it is.
Thank you. And how, not all certainly trainers or exercise specialists are appropriate to assist everyone with an exercise plan, especially for patients who have severe illness or rare diseases. Do you have any recommendations on how would someone go about finding an appropriate person to help them with an exercise plan to keep someone safe who has medical concerns?
Right. So I hope, Lee, that my slide just changed, that I backed up to show you the slide with exercisesmedicine.org/moving through cancer. Did I?
Thank you.
Yeah. Okay. So so there is a directory that I've been working on for 2 years now to try to include all of the trainers that we can find. Some of them are available online. And, so you can have a virtual trainer work with you. Some of them are local. And my email address is easily available from this directory as well. So if you don't find somebody near where you are, I'd be happy to try to help you find somebody. There are national programs that are not on the directory that do virtual training, including Maple Tree Cancer Alliance and 2 Unstoppable. These are 2 other ones.
Thank you. We have a question, and this says, I was told not to exercise my core due to a hernia surgery. Do you have any suggestions on what exercise that they can do?
Yes. Okay. So I'm delighted to say that my website, movingthroughcancer.com, will be live, I hope, by the end of this month. And we actually have a segment that is about recovery from abdominal surgery. And so there are core exercises that are intended for people who've been through colon cancer surgery, hernia surgery, So I would commend those to you, but they include the idea of lying down and head lifts. So not even doing a crunch, but literally just lifting the head while you're lying on your back with knees bent. And then twisting the knees from one side to the other. So there are very gentle core exercises that are necessary in order for the rectus abdominis, transverse abdominis, and the obliques to heal themselves after a hernia surgery. But it needs to be done gradually.
Thank you. And it seems counterintuitive when someone tells you they're suffering from fatigue to tell them that they need to exercise. Like, what is behind exercise actually helping fatigue?
Right. Okay. This is, we get this question all the time. People are like, what part of I'm fatigued do you not get? It's really very frustrating. The physiologic underpinnings for the reason why physical activity is helpful for fatigue, we believe, is because of cytokines. So there's an inflammatory response that's happening that's subclinical with cancer-related fatigue, and exercise has a positive effect on cytokine levels. And so there is actually a physiologic mechanism underlying the benefit of physical activity, particularly aerobic exercise and cancer-related fatigue. It's a good question. It's a really good question.
Thank you. Our next question comes from a patient who cannot do exercise except for adaptive type of exercise. They're just not able to stand for long
Yes.
periods of time. Does that exercise, they'd like to know, does adaptive forms of exercise provide
Yes.
the same type of exercise
Yes.
as regular exercise does? Is it even worth doing adaptive exercising?
Yes, absolutely. I haven't loaded all of them, but we have 3 chair exercise programs on the forthcoming movingforcancer.com website. There are chair exercise programs that are available from a variety of sources on YouTube and online. What constitutes exercise is individual. So what you're looking for from an aerobic standpoint is something that gets you to the level of what we call talk but not sing. And so what we mean by that is that you are still able to have a conversation, even though you have to sometimes stop and take a breath. Okay, but you're not trying to. That's too much. If you can't catch your breath, then you're working too hard. And what gets you to a level of talk but not sing is what you should be doing. And if that means adapted exercise and you're doing seated exercise, then great. That is great, and do it all the time. I hope that's helpful.
Thank you. And we have a question regarding swimming. How do you feel about swimming as a form of exercise for patients?
I think swimming is the universal perfect exercise. I wish I could swim better than I do. I think that there are lymphatic benefits to being in the pool. I think there are emotional benefits to a swimming session. It is outstanding aerobic exercise, and it's got a resistance component. So it kind of puts it all together. It's perfect.
Thank you. Any additional tips for helping patients maintain diet? A lot of times patients, because they're going through treatment, are not able to eat. So any tips for increasing calories or increasing foods that may help when going through treatment? Any tips for increasing calories when you can eat?
Yes. So you want to look for meal replacements, and you want to be very careful with your meal replacements here. What I mean by careful is you want to go for meal replacements that are high protein and low sugar. Okay, high protein, low sugar. Low sugar would be less than 4 grams of sugar. High protein would be at least 20 grams. Okay, so I think that having a case of something that, a version of a meal replacement that you can tolerate in your house so that you can grab it and go, because we're in a grab it go, world. I think that can be really helpful to people. I do think meal delivery services are exceedingly helpful, even if you do them for a short period of time, because as most of you know as well as I do, or if not better than I do, going through treatment is extremely time consuming.
Thank you so much, Dr. Smits, for sharing your time and your expertise with all of us today. We really appreciate you being here with us. If you'd like to watch the session again at a later time, it will be available on the conference platform within the next hour by accessing the session and clicking on replay. Or you can also view by navigating the on-demand tab in the platform hub. If you have any additional questions, please feel free to send it to us in 3 ways. You can send an email to our help account, which is help@aamds.org. Call our helpline at 800-747-2820, extension 2, or submit your question on our Facebook page. Please be sure to visit our exhibit hall today. Our next session will begin in approximately 15 or 20 minutes. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us today, making us your resource of choice for information on bone marrow failure diseases. The AAMDS-IF Medical Advisory Board and team are always here to help you and your family, as we've done for the past 37 years. This concludes our session.